So common symptoms that parents come in for with tonsillar problems. We've got the infective group, which are regular infections, quite simple to pick. The children can be unhealthy looking or very, very healthy looking. The obstructive child is a little bit harder to pick. The parents come in concerned that their child's not doing as well as they could, and they sometimes hear from other parents that snoring can be an issue. So these children tend to be walkers, talkers, thrashers, grinders. They're the type of child you don't want to sleep in the bed with at night because they'll beat the hell out of you as they thrash around. These children tend to wake up looking tired even if they've been in bed for a good 10-12 hours, and because of the hormones they're not producing in their deep REM sleep, they don't tend to eat the same as other children. They tend to be grazers, so they tend to eat all day. They like soft foods. They'll often eat things like strawberries, but they won't eat grapes. They'll eat apple, but not with the skin on. They like carbo foods and sweet foods that give them energy to help them get through the day. And so they'll often eat every half hour if you'd let them. But when you get to a main meal in the evening, you often find that they're not very good with solid foods like chicken and steak and those sort of things. They'll chew on for several minutes before spitting them out sometimes. So the benefits that we see from adenotonsillectomy in children is in the infective patients, it stops. They're no longer infected. The parents aren't getting 5 or 6 episodes a year of the child becoming unwell. Things like febrile convulsions, severe abscess formation, airway difficulties stop. In the obstructive child, we see even bigger changes. We see quite dramatic growth. The children will sometimes grow as much as 5 to 10 centimetres within the first 3 months at certain ages. They put on a lot more weight, they're healthier, they're more energetic. We'll have little children that come back and say things like, we fixed their brain, because they feel as though they can concentrate and focus a little bit better as well.
Care to Share, brought to you by Buderim Private Hospital, because your health matters.